Good morning, everyone, and welcome to this session of our conference. This session is on benefits planning, specifically called Work Incentive Planning and Assistance. And we will have two presenters from the LSU Human Development Center, and they are Donald Ray Leger, and he is a program manager, benefits planner, with 21 years experience on working with the Social Security Administration's Ticket to Work initiative, titled the WIPA, which is the Work Incentives Planning and Assistance. And we also have Rose Angelosi. I think I got your name right, Rose. You'll correct me whenever. Good. She is a Community Work Incentives Coordinator, or CWIC, and benefits planner with WIPA. She also works with LSU Human Development Center, and she has, since 2018, she has provided benefits planning services to individuals receiving disability benefits through Social Security. And without further ado, I will turn the session over to you guys. Thank you.
Good morning, everyone. Again, my name is Donald Leger. Welcome to our Social Security Disability Benefits Planning WIPA Services and Success Stories from West South Central WIPA. My co-presenter, I'm going to allow her to introduce herself at this time. Rose.
Hi, my name is Rose Angelosi, and y'all heard my intro already. So looking forward to giving the presentation. Okay.
I do want to take a moment to thank Jolie Robichaud for the great graphics that she provided to us in our PowerPoint presentation this morning. Jolie, I know you may not be on camera, but tell the audience hello this morning.
Yeah, thank you, Ray. Happy to be here.
Great. I'm going to begin this morning's presentation by telling you what is WIPA. And WIPA stands for, as the presenter just mentioned, Work Incentives Planning and Assistance. It is about individualized, in-depth, employment-focused benefits counseling and work incentives planning in all 50 states and US territories. It is primarily funded through the Social Security Administration, and a critical component of the national effort is to improve employment outcomes for Social Security disability beneficiaries. There are approximately 104 projects nationwide. Some states, especially the larger ones like Texas and California, have multiple projects. The state of Louisiana currently has two. Of course, West South Central WIPA, and our sister program, Lighthouse Louisiana WIPA. If you are on looking at the Louisiana map at this time, Louisiana Lighthouse WIPA covers the clear white areas of the state map that you see there. West South Central WIPA currently covers 33 Louisiana parishes and 21 eastern counties of Texas, highlighted in the purple shaded areas of the Louisiana map. So what are the goals of WIPA? One goal is to increase the number of Social Security disability beneficiaries who choose to work for pay. Another one, support disability beneficiaries in successfully maintaining paid employment or self-employment over time. WIPA goals would be to provide work incentives counseling that enables beneficiaries to increase their earnings capacity over time and enhance the financial benefit of working. Finally, to reduce beneficiary dependence on disability benefits and other income support programs. Now, the last goal here, I want to take a moment. The goal is to reduce the dependence on disability benefits. That isn't always going to occur depending on the situation of the individual that we're assisting. So depending on the disability that they present with and the employment that they require, it may not necessarily end in a reduce or lessening of the dependence on the benefits program that they are being supported by. A little bit of background about WIPA. WIPA was created in 1999 through a legislation known as the Ticket to Work Incentive Improvement Act. Social Security has cooperative agreement, as I said, with 104 community agencies to provide WIPA services. WIPA projects are staffed by trained and certified community work incentives coordinators, although our projects, CWICs, are known as benefits planners. To date, WIPA projects have served more than 750,000 individuals nationwide. So what is WIPA all about? The mission of the program is to simply promote employment and financial independence for beneficiaries who receive the disability benefits programs from Social Security. And what can WIPA do for the beneficiaries they serve? That would include assistance verifying benefits information. As we are not directly employed by the Social Security Administration in this initiative, we are required to verify the varied number of benefits an individual may be receiving at the time that we are providing the assistance. That's to determine, for example, are they receiving Social Security disability? Are they receiving SSI? Verify other benefits as well, and we'll touch upon those as we continue with this morning's presentation. We identify and connect with services or other support programs needed to overcome barriers to employment. So we are not all encompassing. If there's an individual who may need assistance from another component of the Ticket to Work program, they will be referred for assistance to those programs as well. CWICs can understand how paid employment will impact all federal, state, and local benefits programs. And then to identify, use, and manage Social Security work incentives. CWICs can also support beneficiaries with reporting wages to Social Security. They help beneficiaries to successfully manage benefits over time. We analyze healthcare coverage options so that beneficiaries can determine which options offer the best coverage at the most affordable price. And again, we resolve other benefit problems as well. So who's eligible for our services? You have to be receiving either the SSI or Social Security disability benefits, already receiving those benefits and being classified as medically disabled under Social Security's rule for disability. That includes blindness. Those include, again, SSI, and under the disability category, we have child disability benefits and deceased or disabled widows benefits. You have to be at least age 14, but yet not have attained full age retirement. Now, full age retirement used to be the standard age of 65. Now it is based on the year an individual is born. As an example of that, and I'm going to sort of date myself, I will be eligible for disability payments based upon the year I was born when I'm age 66 and 6 months. And so it'll be different for everyone depending on the year that you were born as well. The message. Paid employment and Social Security disability benefits don't have to be mutually exclusive. It's possible to work even at full-time employment and keep Medicaid and or Medicare in almost every case. It's possible to work and come out ahead financially, even if the benefits are reduced or ceased. And it's possible to get benefits back if lost due to employment income from work. At this point, I'm going to go ahead and allow Rose to go ahead and proceed with our presentation on this morning.
Okay. So let's start talking about work incentives. So that's Ray and I work with beneficiaries to look at work incentives are available to them in the process of doing our benefits planning. So work incentives are special rules that make it possible for people with disabilities receiving Social Security or SSI to work and maybe still receive monthly payments. And also either Medicare or Medicaid healthcare benefits. So each work incentive doesn't necessarily apply to everyone. So it's going to be very important to know what benefit you receive to know how to apply the work incentives. So our counseling is very individualized. So we're really looking at what does apply to you. So what benefit you have determines what's available to you. And we'll be presenting some case studies later in this presentation to kind of show you how they're applied. Okay. So let's talk about what benefits are available. So there's two major types of benefits that people might receive. Social Security Disability Insurance, SSDI, is one type. Which includes benefits based on your own work record, perhaps in the past. CDB, like a childhood disability benefit, maybe paid off a parent, or DWB, disabled widow, so maybe paid off a spouse. And then the second type is Supplemental Security Income, or SSI. Next. So let's focus on SSDI first. It's an entitlement funded by federal taxes, the Federal Insurance Contributions Act, or FICA, that you might see on your paychecks. Okay. And eligibility is based on how many quarters you have put in. So under 21, you have to put in 20 quarters to be eligible to receive that, while everyone else has to put in about 40 quarters, right? 40 quarters to be eligible for SSDI benefits.
Mhm.
And on SSDI, let's talk about the return to work. So one of the major work incentives in returning to work, if somebody receives SSDI, it's kind of a phased approach. So there's different phases you move through. The first phase is the trial work program, which is 9 times within a 5-year period that you can earn any amount, but if you earn over a particular amount for that year, and this year it's $970 in a month, if you earn over that, then you trigger a trial work month. They don't have to be consecutive. Some people knock that out 9 months in a row, and others it's scattered over time. Perhaps as they're testing the waters of earnings and what their capacity is to work. But once that phase is complete, once you hit that 9th month and it's used up, then you immediately move to another phase called the extended period of eligibility, which is a 3-year phase that they're looking to see if you're earning what they regard as substantial gainful activity. And that threshold amount this year is $1,350 a month. So in theory, if you're earning over that amount, you would not be due a check. But if you earn less than that in a month, then you would. Now there's other things that we apply to that, because SGA is a decision. It's not a hard and fast thing based on that exact amount. There's other factors that are taken into consideration. And we'll talk about that in our case studies a bit. Okay. And let's continue. So you have some safety nets there, that extended period of eligibility, that if something changes in your situation and you're not working at that level, you can get your benefits back. And reporting is very important with Social Security, and that's how you get your benefits back. You need to report it, first of all, that you're working, but then it's important to let them know about any changes so that they can get you back set up as quick as possible. Okay, more safety nets. So if you move through those first two phases, the trial work and the extended period of eligibility, once you hit the end of the extended period of eligibility, that 3-year period, then you move into a phase where within 5 years, if your situation changes, you can jump back in pretty quickly, but your benefits are going to terminate if you're working at SGA at the end of that extended period of eligibility. But you have this safety net of 5 years being able to jump back in. Medicare. So SSDI is always associated with Medicare as its health benefit. So Part A and B, Part A hospital, and B is like your doctor visits and so forth. If you stop receiving your SSDI cash benefit, it doesn't mean your Medicare goes away. There's an extended period of Medicare coverage. That's a work incentive available to SSDI recipients where your Medicare can continue 93 months after you are finished with the trial work period. Now, you may be paying for that premium yourself if you're no longer receiving that cash benefit. All right, let's turn to supplemental security income, or SSI. Is that other type of benefit people might be receiving? That's a needs-based benefit. And this year, in 2022, people are getting $841 if they're at the full rate. Sometimes it's reduced if you're receiving some kind of maintenance from someone else. So sometimes it's reduced a bit. And this benefit is affected more immediately by work, as your SSI check is adjusted based on what gross earnings are. So reporting is very critical to do in a timely fashion because your check will get adjusted down the line. Okay. Medicaid. So Medicaid is associated with the SSI benefit. So in our state, we automatically get Medicaid if you're on SSI. And even if your cash benefit drops to 0, you have a work incentive called 1619B, and you can earn up to $35,000 and stay on your Medicaid as long as you still qualify. Having a disability, and you have to watch that asset limit of $2,000 in the bank. Continuing with SSI. So there's a formula that we show people how we calculate what we estimate your benefit to be based on your earnings if you're on SSI. And this year, $1,767 a month. If you're earning at that rate, then you would not be due a cash benefit. Otherwise, if you're under that, your benefit would be adjusted accordingly and reduced accordingly. So if you're below that, the 1767, you would receive some money from SSI and some from your earnings, and those added together should show that you're getting ahead. You get more between the two than just the one by itself. And you also have your Medicaid. But if you are over that threshold, your Medicaid could continue under the conditions that I just spoke about. but you may not get an SSI check. Other benefits assessed by us. So we're also looking the big picture, not just your Social Security benefits and the healthcare benefits, but we also need to talk about SNAP and your housing assistance, Medicare waiver eligibility, unemployment, workers' comp. Any of these can factor into your overall benefits profile there and where you are financially with earnings. And the VA benefits too. So I looked over my caseload from the first 2 years and looked at common reasons. Why do people seek us out as benefits planners? Why do people call us at WIPA? So there's a number of reasons why people call us. They do want to know what is the impact on their benefits. A lot of people want to know. They say, well, how much can I earn before my benefits are affected? A lot of people want to know, how do they properly report that? Maybe they're having trouble finding a job. So, some things we look at, we're giving the information directly, and sometimes we might be referring you to other agencies that can assist with some of the things that people call us for. Sometimes there's disability related concerns. People like to talk about accommodations, and maybe sometimes at points where they need advocacy. Maybe they feel like they're being discriminated against. So sometimes we have discussions about those things. Occasionally they get letters from Social Security that can be a little scary, like overpayment notifications, concerns about moving from into retirement, and how does that work? Housing concerns. Maybe they've been suspended or terminated from their benefits. And sometimes people are more worried about their health care than necessarily the cash benefits. And sometimes they have questions. They talk to other people and say, well, why are my benefits reduced? Or what is that being taken out of my benefits? Okay. Let's now turn to some case studies to show you how these work incentives are applied. All right, Ray, take us through some case studies.
The first case study we're going to look at is a young man by the name of Robin, age 53. He's receiving a Social Security disability benefit in the amount of about $900 a month. He's working part-time as a custodian for a local car dealership. His earnings were below the trial work period amount of $740 at the time that I did his particular case. He was in the 24-month waiting period for Medicare. In other words, generally, if an individual becomes eligible for Social Security disability, there's a 24-month waiting period before Medicare insurance is available to them. As a result of that 24-month waiting period, though, he was on what we call special income limited Medicaid here in the state of Louisiana that had a resource limit or an income limit of $1,439 a month. Robin felt trapped because he wanted to earn more, but in doing so, felt that he would lose his Medicaid eligibility, which was the only healthcare insurance available to him. As his benefits planner, I was able to identify the potential work incentives available to Robin. That would include his 9-month trial work period, his extended period of eligibility, and until now, a work incentive that we had not spoken too much about called the impairment-related work expense. And it is a particular provision that is approved by Social Security. It pertains to an out-of-pocket cost that Robin has that relates to his everyday life. But in doing so, that out-of-pocket cost can be extended to the employment that he does or that he's engaged in. I was able to explain to him that he didn't need to limit his earnings only to maintain his Medicaid eligibility, that there were other options for healthcare coverage for him, specifically being individual plans with the Affordable Care Act, for example. With higher earnings, he could then more easily afford the premiums of that individual health plan. As a result, he was referred to acquiring a higher paying job with the Regional Workforce or Career One Stop office. He was also asked to contact his local VR office for assistance. And then he was provided with the Choose Work website with Ticket to Work with the web link that you see on this particular screen. Robin is continuing to receive ongoing supports and services as he continues to look for that job. Once he acquires the new job, then he will be then provided assistance through our program to connect with the Affordable Care Act to see exactly which plan fits the needs that he currently has. And then once his Medicare insurance begins, he has the option of maintaining the Affordable Care Act plan with the Medicare, providing him either 100% medical coverage, or he can just choose to go with the Medicare coverage itself. And of course, as I mentioned before, we'll continue to monitor Robin's case for the duration of his employment life while receiving benefits from Social Security. We're sort of a case management initiative where our clients never goes off the book, so to speak. You know, I've been doing this particular work for some 21 years. And if a client in 2001 contacted me, they're still in our data system where we are still obligated to provide services for that individual, depending on the benefits and the medical insurance that they still have at that time. All right, case 2, Rose.
Okay. All right. So let's talk about an SSI case. So Debbie receives $841 currently on SSI prior to starting to work. And she began working for a social service agency earning $640 a month. And she takes paratransit, which costs her $36 a month. So that $36 a month taking paratransit, since it's disability related, she can use that work incentive of impairment related work expense to help out, you know, with some of that. So, all right, that's our strategy. So with earnings, and applying that impairment related work expense, her SSI check is now $581.50, plus she has the $640 earnings. So her total monthly income is $1,221, as opposed to if she wasn't working, $841 only. Okay, Ray.
Okay. Case study number 3 concerns Tim, age 20. In September 2019, began working as a student worker at his local college. He has autism and receives full SSI and had Medicaid. His CWIC or benefits planner advised him of the student earned income exclusion work incentive and to report his student status and his earnings to Social Security. Now, the student earned income exclusion provides benefits protection for his SSI as long as he's engaged in school between 12 and 15 hours per week and under age 22. What this particular work incentive does then is allow Tim to receive a full SSI. In other words, his monthly SSI payment is not reduced by 1 cent as a result of this particular work support. Now, there is an annual limit on how much you can earn that protects his SSI. But at this particular time, we felt that this particular work incentive was a very useful tool in having his countable income looked at as zero by Social Security, which allowed him to maintain a full SSI. In January 2021, Tim informed his benefits planner that he was notified that starting October the previous year, his SSI check was reduced. Tim explained that the job ended in March of that year due to the pandemic. Recognizing Tim under age 22 in October of 2020 and reminding him that the student earned income exclusion no longer applied. The student then assisted Tim in getting employment verification, dates, and gross earnings by a three-way call with his Human Resources Office and preparing the written request Tim needed. The HR office was able to verify his employment. We submitted that information to Social Security, verifying what his earnings and the dates he had earned the income. The results was that we were able to reverse any reduction in his SSI over the period that he had been employed because, again, engaged in school under the age of 22, it reduced his countable income that Social Security looked at to zero, which meant that, in essence, Social Security owed him SSI payments for the months in which his SSI benefits had been reduced. So we were able to reverse that. And Tim, in essence, should not have had his SSI benefits reduced at the time that he had been employed in earning this income. Okay, case study number 4, Rose.
Let's see. Okay. All right. This is a case for someone receiving SSDI. So remember I mentioned some of the concerns. Sometimes, it's nice for us to catch things on the front end. When somebody's starting to work, we can alert you to things you should start collecting and reporting and some of the strategies that we think we can use down the line. But sometimes it happens that we don't get that opportunity to work with somebody at the beginning of their employment, and we get calls because their benefits are all of a sudden in jeopardy. So actually got, this call was made by someone who received an overpayment notice, and they talked to a colleague, and that colleague had been working with me for a year on his own case. So it came from a word of mouth referral. So she was receiving SSDI, Medicare, help with that, paying that Medicare premium, lower drug costs. And she also had a daughter that was being paid off her record as well. So she got notified that she had moved through the trial work phase. And her benefits she had reached cessation, meaning she was working at the substantial gainful activity level and was in that extended period of eligibility, and told her that she had been overpaid for the last 6 months and they were stopping her benefits because of her earnings level. And she had a lot of stuff to pay back. Now, she had been working at a grocery store. This was throughout the pandemic. And she thought her hours were okay within the limits. She wasn't going to be hitting SGA. She thought everything was okay. But during the pandemic, a lot of your essential workers were paid bonus pay per hour, right? They were paid more than their normal rate. And then we had like a winter storm that came in. And at that point, they were paid several dollars an hour just to come into work to make sure they kept that store open. And just those those slight differences, you think things are going okay, but you're getting increases, which changes the situation. Okay, so strategies that I use to work with this case. So we looked at impairment-related work expenses, which there was some. She was paying out-of-pocket costs for medications and things related to her disability. And then I also looked at what's called a subsidy. So subsidy is available to people on SSDI, not SSI, but SSDI. And subsidy, I like to think of it as an accommodation. So is the employer providing anything to you, like extra supervision, or do you do all the same duties as everyone else in that position? Or sometimes, do you do things at a little slower pace, need more breaks? Are you getting help from anyone else, like a job coach? Maybe if you're blind, reader services, anything like that. Any of those things could be considered a subsidy, which reduces what Social Security considers your actual earnings. So it's not a bad thing. It's more about accommodation. So her employer did regard her as having a subsidy because she was maybe not doing all the duties, or doing a little bit less. So we took both of those and presented that to Social Security. Took the impairment related work expenses, we got all kinds of receipts together, submitted that, and the employer was willing to fill out a form talking about the accommodations they provided in the subsidy. And it turns out the subsidy was enough to wipe out that overpayment and actually reverse the decision on the cessation. So it made a big difference, and gives that room of comfort. Uh-oh. Are y'all still there?
We are.
Okay, my computer just came up with an error. I thought I lost y'all. Okay. And I guess, all these case studies that we presented, this is all based on wage employment. So self-employment is another whole ballpark there. But self-employment is definitely an avenue to consider for people with disabilities, but it definitely, helps to have some guidance in terms of how to document that as well, and how do all the work incentives plus all the self-employment rules apply. So I just wanted to throw that out there.
Rosa, if I can interject here,
Uh-huh.
we try as benefits planners to be proactive in the benefits planning services that we provide. If the individual that we're assisting is proactive in letting us know when a raise may occur, when additional hours from when we had initially discussed with them increases, it changes the narrative of the benefits planning services that we provided them previously. Each time there's a change of a raise in pay, a raise in an increase in hours, we're able to at least forewarn the individual that we're assisting so that they can be proactive in letting them know that, listen, if this is not what you're intending to have your benefits suspended or terminated or impacts to your medical health care, this is what you need to know, and this is how you need to proceed, okay? What we don't want to have happen is, for example, there's an increase in wages. We were not, as benefits planners, informed of that. The individual begins to earn at a level of income that is considered SGA, or may suspend SSI benefits or bring the countable income for SSI to a zero amount so that they're not eligible for the benefits. We can generally curtail the point at which an overpayment of benefits might occur. And that's the ultimate thing here. Part of what we're doing is to curtail the myths and misconceptions about why individuals may have had disability benefits terminated or medical health care availability taken away from them. Because they were just not aware that what they were doing was more detrimental to their the services or the supports that they had. We can tend to help them avoid having to pay back monies to Social Security when it's not necessarily that they have to do that. You know, now, if you want to earn substantially, if you want to be able to get back into the workforce and earn near or at the level of the income you had prior to the onset of your disability, that is great. That is the ultimate goal of WIPA. But we also want to make sure that, you know, let's avoid those overpayments if we can possibly do that by continuing that relationship between your benefits planner and the individual that receives the benefits. That's all I had to say about that.
Mhm. Yeah, we're here to help people avoid pitfalls when possible.
Exactly.
Yes, and Social Security doesn't want to leave people in a lurch. You know, you need to know where you stand financially to know if it's right for you. You know, that's all a part of this, is looking at the big picture and knowing if it's putting you in a better financial situation ultimately that balances with your disability and abilities. Okay.
Correct.
Are you guys at the end of your presentation?
No, not, we got a
Okay.
few more,
Okay,
just a few more things.
you have a lot of Q&A, so that's
Oh,
nice.
okay. Should we roll with the videos and then do the Q&A?
Yeah. So let's begin. We should be on the slide that says, what do beneficiaries have to say about the WIPA services they've received? And we've gotten a few testimonials from individuals we've assisted in the past. Jolie, if you could roll the first one that says, what were your initial reasons for seeking benefits planning services from WIPA?
This is all confusing to me. There's so many rules and laws and things like that. And my son, he doesn't understand these things. And so I'm trying to help him out. I did not know the rules and things and how we were supposed to process that. Then we didn't know how this job would affect his benefits. And then we also didn't know how to get his Social Security straightened out and how to get his Medicaid. We were just a mess, basically. And we needed help. And so we called your office and left a message, and we got a quick return from you, which was very pleasant. And we just needed help. And you came to our rescue.
The main reason I called was I needed an advocate, somebody to help me navigate through the paperwork and the laws and the rules of the system, because
Yeah.
I didn't know what it was.
My reason for seeking out the service was I had been on disability for some years, and I felt the need and wanted to go back to work to do something. And I just needed to know what the requirements were, what I could or could not do. And I had been going online to Social Security and seeing that I could work and that I could make certain amounts, but that was just me reading it online, and I needed to get some more extensive help to make sure I was understanding what I was reading and to make sure I was doing the right thing.
Because I really wanted to go back to work, and I was very unsure of how to go about that process. I was afraid I was going to lose, you know, my disability. I'd heard a lot of myths and stuff. So I guess I just wanted to get the truth about going back to work, you know.
Okay, Rose, second
Okay.
question.
All right, so let's hear from them again about what was the most helpful thing they learned from participating in benefits planning services.
I know that there's just a lot of misinformation out there about if you go back to work, you'll lose everything. That you're unable to go back to work. And I learned all that you are able and what you're allowed to make and how you report it. And because there was a lot of fear in that area, that I would try to work and then have, another crash and lose my job and my disability.
Well, it helped me to stay on track and to know exactly what my options were, what my limitations were. It gave me a time frame to know what I was working with and, what would be required of me within that time period. It just helped me to know that I knew what I was doing and not just going out here in the blind trying to do something that was going to end up costing me in the long run.
You're already stressed as it is entering the workforce. You got so much of that on your mind already, and then having to handle the Social Security and all that is very stressful. And then when knowing that you have somebody there to encourage and support that's good with the paperwork and help you through it in the program, it means a lot.
To learn how to follow the rules, because I am a rule follower. It's just if I don't know the rules, I don't know how to follow them.
Our final question posed to the beneficiaries was, what does the ongoing relationship with your benefits counselor mean to you?
Well, just your encouragement and making it so much easier for me to go through the process. I wasn't alone in it. So that in and of itself was just an amazing thing to do. I knew I could call you with any questions that I had and you would, have an answer for me. Just having the knowledge of what I was able to do was a huge help. And it was just really wonderful to have somebody in my corner and that I didn't feel judged. And just knowing that y'all are there, that if I do come across, a time when I feel like I can't work, that I know I can reach out to y'all and y'all will be there for me.
Has been a real comfort for him and for me, because I know that I can call you when something comes up and you're familiar with what we've worked with.
I know that, situations and circumstances change. I have someone that I can reach out to for help, for guidance, for information, to make sure that I understand what my procedures are, what I need to do, when I need to do it, how I need to do it.
Okay, so I want to lead the audience with one thing, if nothing else, that they've learned from this morning's presentation is that what we do as a WIPA program and the services we provide to those receiving benefits from Social Security and the health insurance that comes with each program, that this morning's information may not necessarily apply directly to you, but we all know someone who may be receiving disability benefits from Social Security. Those benefits payments are not enough to make ends meet. That a job is necessary to supplement the benefits that they're receiving from Social Security. We can assist them. We can help them, as the beneficiary just mentioned, follow the rules, to understand the rules of what to do and when to do it. More importantly, the things not to do to unnecessarily lose benefits that you are not anticipating to have lost, okay? On the screen right now, for the beneficiaries themselves to connect with our WIPA program is to call the Ticket to Work helpline. And you'll see the toll-free number there. There's also a TTY number. They are available to anyone who is interested in services from us Monday through Friday from 8 a.m. to 8 p.m. And because they're having some issues still with staffing the helpline customer service representative staff, they are allowing us to also have individuals contact us directly through the WSC WIPA website link that you see at the bottom of the screen here. We have an online beneficiary referral form that if you can fill out the initial information, submit it through the submit button, we will do or make every effort to reach out to you within the next 3 to 5 days, depending on our caseload. It may be sooner than that, but we'll make every effort to reach out to you as soon as possible. I just want to make sure that you understand that we are here to assist. We are part of the Social Security Administration. I know that sometimes that you may feel it necessary to contact Social Security directly, but they are so swamped with getting those who are applying for benefits or those who are appealing for benefits that the rest of this work has been given to us to provide services to the beneficiaries who needs to know what I need to do in order to make this a success for me. The reporting, to make sure that the healthcare is still available to those individuals. We want to make sure that we're there to assist you as best we can. Rose, is there anything that I'm omitting here that I've forgotten?
Well, I guess we should field some questions to see,
Sure.
you know, and then if we have any other wrap-up thoughts. So
Will
let's see
do.
what our questions are.
Okay, so one of them is my daughter wants to get a job, and someone from Ticket to Work called her a few weeks ago, but has not gotten a call back from her. She asked if we could find out what was the maximum she could make with the NOW waiver, and if there is any resource limit like SSI.
There is a resource limit for SSI of $2,000 for an individual and $3,000 for a couple. We know how hard it is for an SSI beneficiary to attain assets and resources. In a sense, there is a way to avert the small limits of that $2,000 limit for an individual. We will refer individuals to what is called the ABLE program here in Louisiana. The ABLE program is a program that can allow an individual to contribute earnings from employment directly into an account that is protected from the asset and resource limit set upon Medicaid and SSI. The ABLE account is basically an annual limit of $16,000 that can be contributed to the program annually. A maximum state limit right now is $500,000. So we know that in order to attempt to build some wealth for that SSI recipient, there is a means by which they can avert that $2,000 limit as an individual or $3,000 as a couple receiving those benefits. Regarding the Medicaid waiver program, I'm doing a quick calculation of that. It's currently 3 times the federal benefit.
Mhm.
I'm sorry.
Yeah, I was saying that, yeah, 3 times that federal benefit rate,
Right.
3 times
So
the 841.
the monthly limit for that would be $2,523 per month. That would include your SSI and any earnings from employment. Okay, so as long as you can keep your monthly earnings below that amount of $2,523 a month, your Medicaid waiver services will be protected.
And this is Bambi again. It really piqued my interest whenever you talked about the ABLE account, but when you said the 500 up to a maximum of $500,000, I didn't know that. I thought it was $100,000 was the max limit in an ABLE account. And I just looked on the state's website and it still says $100,000. So has that changed?
It has changed. I can include a link that you can go ahead and look at the resources for that particular amount, and I'll put it in the chat.
Thank you.
You're welcome.
The next question is, this person gets a small amount of Social Security because her mom was a retired teacher.
Mhm.
She will be eligible for Medicare in another year. Will she have to pay Part B? She doesn't make enough to cover the cost. And this is from the mom. I only get Part A because of I'm on my husband's insurance. She gets Medicaid from the waiver. So I
And
think people who are on the Medicaid waiver, Medicaid pays for their
Generally,
Medicare, right?
yeah, Medicaid will pay. Now, I didn't hear an employment component to the question you asked. So more than likely, they may be eligible for the Medicare Savings Program. It just depends on the income of the spouse, however. So we would have to sort of delve into that particular case to see if there's a possibility of them being eligible for that program. The Medicare Savings Program does allow for the premiums for Medicare Part B to be covered by the state of Louisiana. But not knowing other specific information regarding their particular case, we more than likely would like to discuss with them other factors that might give us a clearer answer to that question.
Right.
And if you are retired and your adult disabled child gets half of the amount you get for Social Security retirement, is that considered SSDI?
Yeah, yes. Yeah, disabled adult child, DAC is another term for that CDB, Childhood Disability Beneficiary. So that would fall under the SSDI rules.
Okay. And then I have someone who says that they employ some individuals with disabilities, and this is a common issue. I think she's referring to like loss of benefits. I would love to have local support as they have lost benefits and had to pay back, etc. Still have one that doesn't have medical coverage.
What parish is the individual from?
I think from like North Shore area.
Okay. Not to accept responsibility for the answer for this question, but our sister WIPA station, sister WIPA program covers that part of the state. I can provide you with their contact information. I'll go ahead and put that number into the chat in just a moment here. They can contact that WIPA program, and Liz and Zach are very good about answering the questions and concerns of those receiving the benefits. Maybe we can begin to allow that workforce to be able to feel comfortable about working, earning income, and avoiding those overpayments that you're speaking of, okay?
And the other entity that does the same type of program as you in Louisiana is Lighthouse Louisiana, correct?
That
Yes.
is correct. They
Yes.
cover the Florida parishes, Orleans and Jefferson.
Okay, so I'm sorry about that. The person lives in Bossier Parish, so they would contact you.
That would be us.
They would.
Yeah.
They would. Okay, and we are about to put up our, well, the slide showed earlier about how to contact us through the Ticket to Work helpline. If they would give us, give that entity a call, they'll be directed to us. I'm the central intakes person for our program. It'll either be myself or Rose who will handle that particular call and the query of questions and concerns that they have.
But if not, you want to put our website in the chat, Ray? Just,
Yes.
you know, if you have difficulty getting through the Ticket to Work helpline to us, you
Right.
can.
Well, it's on the screen now,
Yeah,
actually.
okay, all right.
Okay. Yeah. Any other questions?
We're at the end of our time, but I just wanted
Okay.
to tell you guys, thank you so much for all this information. And I'm sure you'll get an uptick in people making contact with you guys, but that's a good thing. I think if we have people interested in how to get to work and get to work successfully. So
Yes.
we appreciate you guys, and we'll see everyone in 30 minutes for our next session.
Thank you.
Thank you.
Thank you, Ray. Thank you, Dr.